All right, I think we can begin now. Good afternoon, everyone. First, we would like to welcome you all and thank everyone for attending today's webinar. We hope you all had a wonderful holidays and are able to resume your good work with hardworking spirit. It is a pleasure to host this webinar with you today, discussing about 2020 Medical Care Database Data Submission Manual updates. On that note, we'll get started. Let's take a few moments to introduce ourselves. In the room, we have MHC team, and Kenneth, you want to start?
Janet Ennis.
Canadian Stratman.
I am Shankar Mehta. I joined MHCC in last October. I am the new Chief of Cost and Quality at Center for Analysis and Information System, and I will be the new point of contact if you have any questions around MCDB data submission manual or things like that.
Hi, my name is Debala Akinyemi.
Hi, I'm Ose Emasialu. I'm also relatively new. I'm the methodologist, and I'll be working very closely with Shankar and the Ken, the Center Director.
SSS team, if you have logged in, could you please introduce yourselves?
Hold up.
Yeah, I think.
Okay. Yeah. All right. So anybody who they can talk now.
Yeah. So SSS team, would you like to introduce yourselves?
The names of your
I will let you know.
your names, let me know.
Yeah.
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 Didn't put in information yet.
I'm not putting the information.
And it has the same thing here. She claims I'm going to resend it.
Yeah, I mean that's fine. I think we can get started, and when we turn around, then they can introduce and start with the slide. Yeah. Okay.
Okay. Go ahead.
Yeah, I'm be honest. Okay, so as shown on the agenda, we'll be mainly talking about the improvements in data submission that we have accomplished in 2019. After that, we will discuss about the use cases to reinforce why we need this data, followed by the 2020 deadlines. Then we will discuss about the latest changes to 2020 MCDB data submission. Finally, we'll open the platform for all of you to ask questions and share comments. All right, so let's get started. MHCC mission is to plan for health system needs, promote informed decision making, increase accountability, and improve access in a rapidly changing healthcare environment by providing timely and accurate information on availability, cost, and quality of services to policymakers, purchasers, providers, and the public. To accomplish this mission, it is very critical for us to maintain the robust medical care database. Okay, so we would like to share the progress that we have made in 2019 compared to where we were in 2018. For this comparison, we use the data from the third quarter of 2018 and 2019 as of January 6th of 2020. For the third quarter, we expected a total number of 36 payers to submit the data to MCDB. As shown in the pie chart, almost 78%, that the orange slice in the pie chart, they passed the data validation checks, which was performed by our vendor SSS, which is a significant improvement when we compare to 2018 third quarter, the value of almost 60%. Consistent with that result, the number of payers were under review status during the third quarter of 2019, which is 19.4%, is almost 50% less compared to the same quarter of 2018, where we had a value of 37.8%. And now you all might be asking a question like, what drove these improvements?
So moving on to slide 4. These remarkable improvements are due to improving collaborative partnerships between our payers, MHCC, and SSS. Because of the great partnership, payers made fewer mistakes in 2019, and SSS staff were able to complete data reviews faster.
All right. Now, why do we need this data? As Maryland moves to adopt some very ambitious healthcare delivery reform initiatives, it is important for us to maintain the consumer engagement. To accomplish this objective, MHCC utilizes the medical care database to conduct public reporting and transparency initiatives such as Where the Cost. MCDB data populates the Where the Cost website, which is designed to increase transparency of cost and quality information to consumers about certain procedures to aid in making healthcare decisions. By providing this information on prices for common medical procedures, MHCC enables Marylanders to match the prices with provider performance. This is very integral to our mission. Next slide. All right. Moving on to the decision support tool and state partners, MHCC collaborates with a variety of partners to increase the value of the MCDB in statewide efforts to support the state healthcare policy improvements. The two big partners are Health Services Cost Review Commission, with whom MHCC collaborates to support total cost of care model. Second is Maryland Insurance Administration to perform rate review of covered evaluation and management services. MHCC is mandated to report annually about state healthcare expenditures. To meet this requirement, we create two reports, privately insured report, a professional service report. Privately insured report is created on annual basis to provide information about spending and use among Maryland privately insured population with less than 65 years of age. It reports on variation by market segment, region, age group, and service category. Professional service report leverages reports on the trends in the service of volume and level of payments for healthcare service provided by physicians and other professionals to privately insured non-elderly residents of Maryland. All right. So on that note, I will turn over to SSS to talk about the MCDB deadlines. Can you check if SSS has joined?
Taharat, can you hear us? Ashravani?
You have to click on the command to
Can you hear me? Can you hear me?
Yes, we can. Is that Taharat?
We can hear you, Tara.
Okay, great. Thank you. I apologize. We were having technical difficulties earlier, but thank you, Shankar and Debola. My name is Taharat. I'm from SSS. And so if everyone can hear me, I will begin talking about the 2020 MCDB deadlines. And if there are any questions that arise, we will hold a Q&A at the end of the presentation. So can we please go to the next slide? So this is the schedule for the 2020 MCDB data submission. Please pay particular attention to the final data submission due date. Quarter 1 is May 31st, 2020. Quarter 2 is August 31st, 2020. Quarter 3 is November 30th, 2020. And quarter 4 is February 28th, 2021. Can you please move to the next slide? And so final data means that payers must report clean data to the MCDB portal on or before the final data submission's due date. Clean data means that the data has passed all the validation checks performed by SSS. Next, data is considered late if submissions have not cleared all validation checks by final submission date or approved extension date. If reporting entities need an extension, reporting entities must request a waiver on the MCDB portal on or before the extension request deadline for each reporting quarter. Next, I will begin discussing the changes to the 2020 MCDB data submissions. So the first change is in the professional services file, and this is to the drug quantity field. The length increased from 5 to 6 due to a payer requiring a field length of 6. And so it was decided to increase the length for all payers. And the next change is in the pharmacy services file. The drug quantity field length also increased from 5 to 6. And due to Aetna's request, 2 new fields were added. The first one is the planned prescription drug rebate amount, and this is the amount passed along to the client. The second field that was added is the member prescription drug rebate amount. This is the amount passed along directly to the member. The next change is to the institutional services file, and this included adding the bill provider location zip code plus 4-digit add-on code. This refers to the location of where the service was provided. This is the same as a service location zip code plus 4-digit add-on code in the professional services file. It was added to the validation rule column, and the billing provider zip code information is located on the UB04 claim form. Next, we'll talk about the changes to the eligibility file. We changed the contents of policy type. Previous to 2020, we had 2 categories. The first one was individual. The second one was any combination of 2 or more persons. Now we expanded upon the categories to include 7. And so the first one is individual. The second is individual plus child. The third was individual plus children. The fourth one is individual plus spouse. The fifth one is individual plus family. The sixth one is 2-party coverage. And the 7th one is dependent only. And this includes child only, spouse only, partner only, or other adult only. Next slide. Okay, thank you. Now we'll begin talking about frequently asked questions. And so the first question is, will waivers be provided for the new fields? R043, planned prescription drug rebate amount, and R044, member prescription drug rebate amount. Now, MHCC does understand that there may be some extra time involved in reporting on new fields. In the short term, we'll approve waiver requests for payers who need the extra time to report on these new fields. However, we would expect payers to include their long-term remediation plans on improving data collection for the respective new fields as part of their waiver request submission. Next slide, please. And so we will now discuss self-insured statuses. We are often asked by payers how we classify self-insured statuses. This table can be used as a reference and delineates between self-insured ERISA, non-ERISA, fully insured, and unknown not coded, as well as the plan liability and coverage type. Next slide, please. The third question is how to encrypt patient enrollee identifiers, internal subscriber numbers, and contract number fields. So payers can follow any encryption algorithm of your choice. Once selected, it is imperative to keep the same algorithm or the encryption key for future submissions that is unique to each payer. This is incredibly important for consistency. The link that is provided provides examples on how to implement AES encryption in PHP and Java programming language. The next question is, why does the CRISP file not require an encrypted social security number? The CRISP organization confirmed that the following unencrypted fields are used to derive MPI values: full name, date of birth, gender, home address, or social security number. These 4 values are extremely important for CRISP. They are unable to accurately derive MPI values if any of these values are missing, so please ensure that these fields are populated to the fullest extent when making your CRISP submissions for the quarter. If this is not possible, SSN is preferred, but not necessary if home address is present along with the first 3 data elements. The last question is, I had requested a column length or threshold waiver back in January, and it hasn't been approved yet. Now, as per MHCC's instructions, SSS recommends column length, threshold, and certain other waivers for approval only after initial data submissions by the payer. This is to ensure that the waivers are applicable to the data being submitted by each payer. Now, lastly, as a reminder, PBM and TPA payers who don't participate in ACA compliant plans must submit waivers for fields that relate to the ACA compliant plan. Examples of these fields are grandfathered plan indicator, metal level plan indicator, cost sharing reduction indicator, and HIOS. Next slide, please. And so now we'll open the floor up for payer questions and discussion.
Hi, this is Bernie from United, and although this was very helpful information, it was provided quite rapidly. Would we be able to get a copy of this deck and be able to ask questions and provide feedback after having a chance to take a look at it?
Absolutely, Bernie. So after this call, we'll make some slight updates based on the input we get during this meeting, and then we'll send out the final version of the slide deck to all the participants. Yeah, any more questions or comments from the folks on the phone?
Don't be shy, folks. That's the question.
Hey, this is Srini from CVS. I have a question. The new DRG changes, right? The addition of the increase of the column PC fields and new columns to the member eligibility, right? Is that going to be effective from 2020 Q1 submissions, which is due in April?
Srini, can you please repeat which field you're talking about?
Right. So it is like drug quantity increase as well as the increase, addition of the two new fields to the claims, right? Are these going to go live as part of the 2020 Q1 submissions?
Yes.
Okay.
This
Okay,
is
thank
Matt
you.
from Prime. I have a question about that. We've sent the request to our IT team to create the report for the new rebate fields. I don't know if they're going to be able to complete it in 2020. Are the waivers going to be available for the entire year?
Absolutely. We are going to work with each payer to accommodate the reporting of this field. We know it's a new field, and we know with rebates in general, sometimes it is collected at the end of the year or semi-annually. But we will work with payers to really get this done in a timely manner. So if you can't provide this information by the first quarter, second quarter, just let us know and submit a waiver, and we will accommodate that.
Thank you. That makes sense. Our system is set up so that rebates is in a separate platform, so that helps. Thank you.
I know there are more questions out there. One of the other things I want to comment on is that for PBMs and TPAs, I know any information that is related to the ACA compliant plans information, things like the metal level or the grandfather indicator or the cost sharing reduction items or indicator, those things don't apply to a PBM or TPA, as PBMs and TPA generally will have only self-insured information. So So we don't want to payers to go down into the abyss trying to look for things that really does not apply to them and they don't have. So I will work with SSS as well to alert SSS that TPAs and PBMs, as far as the ACA compliant information is concerned, doesn't really apply to those two payer types. And also, regarding the, I would just say a note regarding the non-claims-based reporting. I know we have this information in the data submission manual since 2014. During the coming months, we will engage payers, to find out from them, what they have regarding this information. And that is including rebates as well, pay for performance, incentives. These are considered to be alternative payment models data. So we will be sending out a survey to engage with payers to find out how they're reporting this information. Bernie, I know when I just started at MSCC back in 2014, I remember we had a meeting with you back then, and you told us that information is not collected by your team, but in a different area, and it's not readily available in files and stuff like that, and most of it is collected at the end of the year. So I know a lot has happened since back then, from 2014 to now, and now this is at the forefront of reporting. So we just like to send out a brief survey to engage payers to find out if they have the data and to what extent they have it, and how is the best way of reporting that data to the APCD or the MCDB. So just want to put that out there to look in the coming months for that survey.
Hi, this is Kieran from Express Scripts. Just wanted to quickly ask if you can include those fields that don't apply to the metal level fields that don't apply to PBMs and TPAs. That would be great, so we can make sure that we conform and that we're meeting the requirements there as well.
Excellent. Sure.
Thank you.
Okay, have your last chance. Any more questions?
Well, I don't have a question, but I do have a comment. I see that this is being recorded. Will we have the ability to have the recording as well? This is Carol Goskett from Wellfleet.
Yes, of course. Yeah, we'll share that.
Terrific. Thank you.
Sure. Okay, if you don't have any more questions, I think we can wrap it up. We covered everything that we had on the agenda. Again, we want to thank you all for taking time off your busy schedules to attend this webinar. If anyone has any questions or any more comments, please reach out to us and you can send us an email or call us. All right. Thank you.
Thanks, everyone.
Thank you all.